I would like to introduce you to another research from online session about retrospective analysis of time duration between green pit fiber bite to anti-venom administration and complications of GPV in the population of Bangkok and vicinities. From Ms. Picha Pattrapruettada.
Hello, my name is Picha Pattrapruettada, and today I will be presenting on the topics of retrospective analysis of green pit viper bites to anti-venom administrations and complications of green pit viper in populations of Bangkok and vicinities. Snake innovation remains one of the most neglected tropical diseases to date, annually affecting more than as many as 2.7 million people worldwide, with an estimated mortality rate of 100,000 people per year. In Thailand, about 8,000 people got bitten by snake bites, and most commonly from green pit viper or GPV, and namely the Trimeresurus arboreus and Trimeresurus macrops. Green pit viper toxins is a hematotoxin containing thrombin-like effects that induce the conversions of fibrinogen to fibrins. However, the fibrinopeptide A and B would not be produced to strongly stimulate the factor 13, which is the fibrin stabilizing factors. As a result, it will lead to venom-induced consumptive coagulopathy. The toxin causes prolonged systemic effect with wide range of complications leading to high morbidities. The signs and symptoms manifest in the patients with green pit viper bites are prolonged whole blood clotting times, low platelets, prolonged prothrombin times, bleeding, tissue swellings, tissue necrosis, and potentially compartment syndromes. And the treatment of choice for green pit viper bite is to administer the antivenoms to neutralize the toxins. In terms of the timelines for the treatment plans, starting from the getting bites, communicating to the hospitals, and waiting for the time for the physicians to examine the patients and evaluate the patient's conditions. Then we order the antivenoms, and then the nurse administered it. There is a long period of time between the patients from getting bites to administer the antivenoms. From the past report, it took an average of 29.7 hours from the bite to antivenom administrations, which is a long time that it could have an effect on the symptoms and progressions. Therefore, our question is, does longer time taken to administer the green pit viper bite antivenoms contribute to more complications from the GPV bites? And our objective is to identify the time taken from bites to antivenom administrations, as well as to identify the complications of the green pit viper venoms. For the inclusion criteria, we include any patient who visited Sirindhorn hospitals between January 2009 to November 2020, with an ICD-10 of T63.0, which is for toxin effects from snake venoms and classified as a hematotoxins, and any patients who receive antivenoms. For the exclusion criteria, any patients who have missing medical records on time of bites and the time of antivenom administrations, as well as doesn't have a green pit viper as a final diagnosis or receive any other types of antivenom which is not for green pit viper. And then we group patients into 8 groups based on the time from bites to antivenom administrations, or the TA time. Then we compare it to the 8 complications from the green pit vipers, which are the low platelet counts, prothrombin time, systemic bleeding, tissue swellings, compartment syndromes, blisters, and tissue necrosis. Then we find the associations between the TA and the complications using a Spearman correlations and Creutzfeldt-Wallis test, as our data was skill data. And for the results, based on the inclusion and exclusion criteria, there were a total of 1,771 patients. And then when we using our criteria, Living only used 117 patients. And for the baseline characteristics of the patient in the studies, the median age is 47 years old and predominantly were male and mostly got bitten on the hands outside the house. In our studies that we obtained from January 2009 to November 2020, the average time taken from bite to anti-venom administrations is about 7 hours and 10 minutes. And when we classified our subjects into 8 different groups according to the time from bite to administrations, is the list below. And that for the results, this table shows the complication severity degrees. And interestingly, only the platelet counts and the blister and tissue necrosis were statistically associated with longer TA time. From previous studies, the median time taken prior to abnormal platelet counts was 18.75 hours, which corresponds with our results. Higher severity of blisters and tissue necrosis both show to be associated with longer TA. These two parameters are associated with each other, and previous research have illustrated that blister increase the chance of tissue necrosis with an odds ratio of 5.07. However, the prolonged prothrombin time, systemic bleedings, tissue swellings, and compartment syndromes were not associated with longer TA. And in conclusions, the median time taken from bite to anti-venom administration is 7 hours and 10 minutes, and the longer TA is associated with more severe complications of platelet counts, blisters, and tissue necrosis. For future studies, we could expand the studies into a multi-center studies, which includes other hospitals besides Sirindhorn hospitals, and also we could do a randomized prospective trial. And thank you for your attention.
Thank you so much for the presentation, of course. We're proceeding to the question and answer session. May I receive a question from the judges, please?
My question, actually, we know that green pit viper will affect on the common pathway, so will affect both PT and PTT. So why you use prothrombin time to predict for your study?
I think the reason that I use the PT time is because it is easier to, when you want to compare the INR ratios, and it's the classification to when it's one of the criteria for you to start to administer the anti-venom.
Do I have more questions? It seems that there is no more question from the judge. So we're taking a little time for the scoring process.